Let's move on to the doctor that we like to bring in to talk about all the things COVID that are going on. One of them is Dr. Sejal Hathi, physician and clinical fellow at Massachusetts General Hospital and host of Civic Rx, the podcast. Good to have you here, doctor. And just very quickly, this news out of California, possibly lifting all of its restrictions but keeping a mask. Sounds good, is it?
So firstly, thanks for having me. It's a pleasure to be here as always. We're starting to see a number of states beginning to lift COVID-19 public health precautions. California is not the first to openly discuss this, but I think it's important to recognize that even as we have hit an incredible landmark with 3 million vaccinations per day, we're still in the throes of pandemic and many hotspots are still emerging. The country as a whole has seen a 7% increase in the number of new cases of COVID-19 this week as compared to last week. So although discussions around new interventions like the vaccine passport, around lifting restrictions are good and promising, and while I do join many public health experts in thinking that by this summer we're likely to return to a semblance of normalcy, I think it's imperative that nonetheless we practice caution, wear masks, maintain social distancing, and not travel unless we're vaccinated.
Doctor, how about that double mutant variant that was detected out in California? Can you just tell us, what do we know about it at this point? And does it raise then the likelihood that we could possibly see another wave?
Yeah, that's an excellent question. And, this double mutant, as it's being termed, was first discovered only about a couple of weeks ago, and that too in India, in the wake of a surge of infections in the state of Maharashtra there. And within a couple of weeks, it's been identified, of course, in the Bay Area in a patient in Stanford Healthcare. And this variant is dubbed a double mutant because it contains two significant mutations simultaneously, the first time that this has ever happened. And these mutations are important because both affect the coronavirus's spike protein, which of course is the part of the virus's outer layer that binds to human host cells and that enables the virus to penetrate those cells, and which in turn has been the specific focus of vaccines. The first mutation is similar to a mutation identified on both the Brazilian and the South African variants and is believed to change the shape of that spike protein. And the second mutation has been found in pre-existing California variants and is believed to facilitate the spike protein's entry into human host cells. So the concern is, of course, that this double mutant is going to be both more transmissible and possibly more resistant to vaccines. So, of course, we're still very early in sifting through the data.
This idea of a COVID-19 passport, what are your thoughts about that? And I'm not talking about traveling internationally. I'm talking about to get into your office, to go back to work, or to go to a restaurant.
I think that it is a tried and true public health intervention. We saw this first over 100 years ago with the smallpox epidemic. And even then, there was some resistance among the American community, but it proved a vital and powerful tool for, again, returning to a sense of normalcy. So I think that we still need to determine the kinks and ensure that any vaccine passport that we develop is standardized, is clear, is accessible. But I think that it can, again, be a very important tool for us in returning to a sense of normalcy, safety, and security that, we are socializing with, working with, gathering with other people who can prove in a very visible way that they too are vaccinated.
All right. Thank you for your insight, Dr. Sejal Hathi, physician and clinical fellow at Massachusetts General Hospital, also host of Civic Rx, the podcast.